Hi everybody, this is Kevin and I'm back on the Zoom chats again. And with me today, I've got someone that I've known now for, I've just found out actually it's 32 years that I've known. And this is Louise, and this is Louise Musgrave. So hi Louise.
Hi Kevin, nice to see you.
Nice to see you. It's been a long time since we've seen each other.
It has been a long time. Kids, life, yeah.
Yeah, your kids were quite small when I last saw you last. But for everybody that's followed my Zoom chats, I've done a walk with Louise's father, and I've also done about his book in particular, but also did a walk with her mum and dad, and that's David and Jean Gilbert, when they were looking after a house, and Cynthia and I went and did a walk. But the one thing I wanted to particularly get Louise to talk about today is an issue that I think started when she was probably in her mid-teens. Is that right?
Probably. Actually, it probably started my rheumatoid arthritis when I was quite young. I think when I was a teenager, maybe maybe even younger, maybe 8, 9 years old. I didn't realise that's what it was until I got a lot older.
So you were getting some sort of symptoms even at that young age.
Yeah, definitely. When I was having problems, I used to wake up in the night crying because I thought they were growing pains, and my mum used to put it down and say, "Oh, you're fine, it's just growing pains." But I think that was the beginning. But I didn't realise it until probably in my early 20s is when.
Right, okay. Because when I first met you, you were 15, and that's when I first started doing work for your mum and dad, and you were at Warmer Hill School doing your exams, which you were really not keen on doing. And I know your mum thanked me very much for actually getting you through them, because I actually took you to school, because you said you would only go to school and do your exams if I took you up there and then come and picked you up, and that's what I did.
Absolutely. I was my parents were very much focused on education, and I was probably a bit naughty, really. How I've ended up working for a university, I don't know.
No,
I was more.
We'll go. Louise has changed careers. Well, I didn't know she'd changed careers. I thought she was still doing what she was doing before, but we'll touch on that later on. So, but when you were, I wasn't aware when I first met you when you were at the age of 15, that you were having these issues. And then, as you say, probably in your early 20s is when you really knew that you had rheumatoid arthritis. So can you tell everybody, Louise, when you realised what you'd got, how did that affect you at that age?
Well, it's quite funny actually, Kevin, because I got to go along to a support group. They sent me. The hospital said, it'd be a good idea once I was diagnosed properly. I think it was around the age of 23. They said to me, it'd be a good idea if you go and join a support group. So I thought, okay. Got nothing to lose, so I turned up, and the majority of the people in the support group were probably 50s plus. We had to sit in a circle and go around the group and say, how did having rheumatoid arthritis affect you? And some people were saying, oh, it's difficult for me to do my gardening, or it's difficult for me to go out and socialise, and for me it was difficult to go out night clubbing. That was the biggest thing for me, because I was at the age where I'd got through uni days and partied there and seemed to get away with it. Did have some pain. I mean, I had some really good friends, my friend Zoe in particular and Joe. They'd always make sure that I was all right, and maybe I'd be hobbling around and help me to get into the car or however we'd be getting home. And I think that's when I really started to notice, when I started working at the Crown Plaza, Heathrow, in the sales team, and wanting to go out and have this, I was very, very active, always have been. And that's really when I started to notice that something was wrong, because I couldn't party as much as I had done.
As somebody in their early 20s, that's what you wanted to do, so it started to impact your life, from going out and enjoying yourself and things like that. But how did it sort of progress from there? Did it get to the point where you couldn't work or you couldn't go out, or how did it impact you that way?
It did, but because of my personality, I've always been a really positive person, and I've always, when I got diagnosed, it was a bit of a shock. I knew something was wrong. I knew it was holding me back from doing what I wanted to do, but I had this attitude of it wasn't going to beat me.
Yeah.
I was going to live my life to the full, and I was going to carry on as I planned from a young age. So I had this very, very much a positive mentality, and I read so many articles of people that didn't necessarily give up, but they let the pain control them. And I thought, I'm going to flip this on its head, and I'm going to control the pain. I'm going to be the one in charge of this illness rather than the other way around. I think to this day, there have been times when it's been really tough. I'm not someone that talks about it quite a lot, so it's quite, I don't know, when you asked me to do this, I was like, oh, I went and had my infusion last week, and I said, oh, I'm going to be interviewed about my illness, and I don't normally talk about it because I see that not being vulnerable, but almost giving into it and accepting it. But I suppose now I'm 47, I have to accept it, and I have to.
But I don't think you've got the sort of mentality that will, even at your age now, and even in, you know, and perhaps in the next 10, 15 years, that it's hopefully with your mentality, you're going to still be beating it rather than it beating you. But I think with these sorts of things, Lou, I think it's very important to talk about these things. I recently, a few months ago, I did another Zoom chat with another friend of mine, Lara, who suffers from endometriosis. I had heard the word, but didn't know how seriously it impacted women's lives and how many people and many women suffer from it. So I think it's important to talk about these things. If I didn't think that you would be able to do it, to be honest, I probably wouldn't have asked you. But I thought, well, I know you well enough, and to be able to get you to do this, and you've agreed to it. So from your point of view, really, that is a huge step forward, that you're actually being able to talk to me about this illness you've got, and all credit to you. So you've gone through your uni stages. You're still going out clubbing as best you can with your friends, and then you obviously you've had boyfriends and things like that, and then you met a guy called Phil. And
I had a few boyfriends before that, but yeah.
I know you did, darling. I know you did. But I think you were going out with somebody, but you were, correct me if I'm wrong, were you renting somewhere or living somewhere?
No, I bought somewhere. I think my illness, pretty much, even though I said it wouldn't control me, when I sat in front of the doctor and he said to me, Dr. Ben, I don't know if he's still around. I don't think he is. I think he's passed away. But he basically looked at me and said, if you are planning to have a family, then you really need to think seriously about it. And I was probably about 25 then, 24, 25. And that was a real shock to me. And I think that's when I started to really think about relationships and having children and needing to settle down, because I knew I wanted to have children. So I think that was the big changer for me, having him say those words and knowing that I would have to come off my drugs to potentially get pregnant. So that, I think that was a big game changer as well.
Absolutely.
It put me on a different path probably to if I hadn't have had the illness. Sometimes I'm grateful. I am grateful sometimes for that. Actually, if it wasn't for my illness, I probably wouldn't have my two lovely children that I have today. So, but
but if I remember rightly, your lodger became your husband or your boyfriend before your boyfriend, then your husband.
Yeah. So he paid the rent and ended up paying the mortgage. handy.
Fantastic scenario. Good for Phil.
No, he has to pay more than a mortgage.
Yeah.
There you go.
Yeah. But so you know, I know Phil. I've known Phil for a long time. So you met Phil. You decided after a while that you wanted to get married. But tell me, do you know what was Phil's feelings about the fact that he obviously knew your problems, but he was that understanding that he was prepared to, and I don't mean this in a rude way, to take you on.
Yeah, no, absolutely. And I think not to be, you know, I think probably my illness scared quite a lot of my previous boyfriends away, you know, just because it is such a huge deal. And I've got to say that, you know, Phil definitely took that on as it's not easy to live with somebody with rheumatoid arthritis. I'm not saying because obviously all my ex-boyfriends were lovely and did help me out as much as possible, but I think as I became more aware of what I needed to do, maybe to have children, to settle down, maybe at a younger age than others would have wanted, then I think that it became a deciding factor. And also Phil wanted that as well. He was willing, and he has been, without using the word carer, because I'm not somebody who likes to be cared for, but he does do a lot. He probably does a lot more than the average partner would do. And I think he knew that right from the beginning. That was the role we had to play. So it seems to have worked. He's still with me, just about.
and you know, he's a great guy. I know him, and he's a fabulous guy. So you got to the point where you wanted to start a family. So as you mentioned or hinted at just now, you had to come off of all your medication to get pregnant.
Yeah.
What effect did that have on you coming off of your medication? Can you give us an idea of what medication you were taking as well?
Yeah, so when I first got diagnosed, I was very much on the sort of low-level drugs, methotrexate, sulfasalazine, steroids. And it was at that point, Dr. Ben said, if you want to have children, you're going to have to think about, because you can't take those drugs whilst trying to conceive. So, and there wasn't anything, probably there is now a lot more on the internet, but at the time, there wasn't much for me to read and to learn. And I didn't know what to do because, again, the support groups that I had were older people, not younger people with arthritis. So I made the decision that the best thing for me to do is come off all my drugs, and that really set me into a flare-up. So I was practically laying on the sofa, could hardly move. I then went to see Dr. Ben and said, look, this is what I've done. Probably a bit silly. If any advice I'd give to people, speak to your doctors first. Take it into your own hands. But then he put me on steroids, which helped somewhat with the pain, but the side effects were weight gain. The steroids were awful. I couldn't bear the steroids. The last thing I ever want to do is go back on steroids again. But I did it because I knew I wanted to have children. So, when I got pregnant with Harvey, my arthritis weirdly went into remission whilst I was pregnant, which I was like, this is brilliant.
Wow.
I had less pain. I didn't have to I still took steroids, but a lower amount. I did have gestational diabetes, and I do think that was probably, again, to do with something not quite right. But I took metformin during my pregnancy, and that seemed to help my arthritis as well. But when I had Harvey, I then got a massive flare-up. So literally, after probably, say, 48 hours, it came back with vengeance. So I was in this sort of denial world of, oh, this is great, it's probably gone. But and I'm sure others that have had pregnancies whilst they've had rheumatoid arthritis will say the same. Unfortunately, when it comes back with a vengeance. So I had to stop breastfeeding after 5 weeks, which upset me at the time. It was I wanted to breastfeed Harvey, and I had Phil stop saying, no, just get on your drugs, you don't need to do this. And I was quite adamant. So I put up with the pain for about 5 weeks, 5-6 weeks, and then went back on stronger drugs. And this time I switched to Enbrel, which was a life-changing drug for me. It was just amazing. So I had to inject myself, and it was an anti-TNF drug, some of the new biological drugs that had come out at the time, and that worked wonders. But strangely, it worked for a period of time, and then all of a sudden, out of nowhere, stopped working, and the doctors don't. Yeah, and that can happen sometimes, which was unfortunate for me. I did have that. I remember taking the buggy out the back of the car thinking, oh my goodness, I've got strength in my arms that I never had before. Obviously, once the Enbrel stopped working, and then I knew I wanted to have another child, I then had to go through the process all again. So
you had to come off your meds and everything else, and then you had Lily, Lillian. But I remember seeing you, I think it was when Harvey was a baby. And what shook me the most, excuse me, was the fact that you couldn't pick Harvey up with your hands. And likewise with Lillian when she came along, because of the arthritis in your hands, you were picking your babies up with your arms. You couldn't use your hands. But how did that in your mind, how did that work for you? Because you see mums grab hold of their children or a baby and they pick them up with their hands, and it's a natural thing. Or it looks strange to me, but it's the only way that you could hold or pick up your babies.
Yeah, I mean, I used to sometimes pick up Harvey if my arms were hurting as well with my teeth, and this is when the pain was coming back, where the drugs weren't working, and I had to get onto Enbrel. So then I'd use my teeth to pick him up. It was hard because there were times, especially when they became toddlers, and I'd have to try and pick them up quickly. I'd say for me, and I'm sure mums that have kids at the same age, like the 2-year-old, that was really, really difficult because they're off 100 miles an hour and you can't catch up with them that quickly. And then it becomes dangerous as well. I remember when Lily was about 3, I always tell this story. We went to Toys R Us in Woking, and I told her, do not run off because I can't catch you. The doors opened to the lift in the Woking car park, and off she darted in front of a car. And I was like, because I wasn't able to pick her up. And there were other instances that Phil and I were coming back from, I think we've been away to Canary Islands or somewhere, and Lily was having a tantrum, and he'd gone off to get the luggage, and I couldn't control her. She was having a proper tantrum, and there's nothing, and people were looking at me, said, pick up your child, but I just couldn't. So I had to learn other ways. And I think in a way, probably that's why my children are very independent. As you know, Lily's like a figure skater, and Harvey's she's doing really well in that. And Harvey, again, is very sporty. So I've always given them this sort of, I don't know, wanted them to be independent. So having arthritis has allowed them to do that. I couldn't ever sort of mollycoddle them. Lily was feeding herself with a bottle from about 4 months, I think, 4 to 5 months of age, and she could pick up a bottle and feed herself, and people used to be a bit amazed at that, but it's because I couldn't do it, so they sort of adapted themselves. And I think that they've done that as well as they've grown up. Well, I don't know Lily so much, but Harvey again is like Phil. He helps me out, carries the shopping, never asks any questions, just gets on with it. So I think in a way it's taught them to be more independent.
It certainly sounds like it. I haven't seen either of your kids for some years, but I certainly follow what Lillian's up to with her figure skating, and she's doing absolutely amazing. And I know your dad, he runs her around quite a bit, doesn't he? So yeah,
they're amazing. And that's the other thing as well. I mentioned my parents. They've been amazing throughout the whole time. Again, they've been more of a support and caring for me, helping me out with the kids. And so I think it's having that support network around you as well really really helps. If you've got friends and family and good people that are willing to and even the people I've worked with, they've made me smile. Some of them we've almost had a joke sometimes about my illness.
Well, I think sometimes with certain things that if you don't laugh, you're going to cry. And that's probably the most positive way of looking at it. So where are we now with your condition now, Lou? What's happening with you now?
So luckily, once Enbrel stopped working, I then switched to a drug called rituximab, which is chemotherapy, I suppose. They use it. Interestingly, they used it for my mum's cancer. She had non-Hodgkin, or she's still got non-Hodgkin's, yeah. And it pushed her into remission. It worked for me. Obviously, they don't give you the same dosage as a cancer patient, but it's just a lower dosage of it once a month. It worked really well again for me. The infusion took a long time. That was like 5 hours or 4. It was quite a few hours, so you'd have to prepare to go in the whole day, really.
Yeah.
But again, rituximab stopped working, like Enbrel.
Oh no.
So yeah, so I had that for a certain amount of years. And what's happening now is, obviously with the NHS, there's only so many lines of treatment that you're allowed to try. And if those lines of treatment stop working, and this is where I am at now, I'm on the last line now. So I'm on something called, we call it toxicilumab, something like that. It's Toki, we call it Toki. It's a new drug. It's a wonder drug, and it's working for me. The only problem is my liver counts sometimes are not great. So I have to try not to drink too much. It's a bit sad. In lockdown, the doctor rang me and was like, you can't drink alcohol and take this drug, which is very sad. But yeah, so it works for my arthritis. It is having a little effect on my liver. So I'm praying now that this works, because I've now gone to the end of the line with the NHS, and there's no more drugs that financially, it's all to do with the finances now.
Yeah, of course. Yeah.
They only allow you.
We'll have to start a fundraising page then.
Yeah. No, we're not. But this drug's working. Let's pray to God it doesn't affect my livers. They keep an eye on me.
Absolutely. Yeah, we'll certainly keep our fingers crossed. So, because I know what's happened over the last couple of years has affected a lot of people. I know you and Phil have been affected by COVID and job losses and stuff like that. But you are still living very close to your mum, probably even closer now, aren't you? Just round the corner.
That's right. Yeah. It's been a tough couple of years. I mean, because Phil was working in hospitality, MD of a company for hospitality IT software, and obviously hospitality was one of the first things that went. So their American company closed down the UK offices. So he's been working as consultancy jobs. So he just got a new job, which is really good, really happy.
Excellent, good.
So he's just secured a job for procurement IT software as a director for a company. So that's good news. So we're on the up. I ran Purely Events, which was my.
I was just about to say that when I last saw you, you were running a business called Purely Events, which was an you organised functions and parties and weddings and things like that, didn't you?
Yeah. Which I'm still doing. I haven't. I'm organising a gay wedding, which I'm really excited about. Obviously, that got pushed back due to COVID. I mean, basically the events industry just died, as you can imagine.
Yeah,
everything died a death. I was working part-time at the University of Law, but seemed to have done all right there, because they had a job for an online recruitment manager, and they've basically thought it'd be a good idea if I went for the role, so I did and got it.
Good. Well, good for you. So, you're positive thinking, and I think this is what is getting you to where you are now. You know, you keep going. You know, whenever I see nobody, people that watch this don't know, but Lou was trying to use her phone and it kept falling over. Then she decided to go onto a computer, so she had to shut down the first part of the chat, and she went off. And I sat here thinking, in all the years I haven't seen her, she's not changed a bit. She's still the same, Louise. Which is ever. It's great. It's the same Louise, but we're just a little bit older Louise, aren't we? You know.
Yeah, exactly. A bit more mature.
Really?
Yes. Well, I don't know. Sometimes I try.
Well, I think you've done absolutely brilliantly.
Thank you. That's really nice.
You really have. Because I said to her just now, I haven't seen you for a long time, but I know the early years, how you struggle with, particularly with the children and stuff like that. And I suppose really you really struggled when you met Phil, really, more than you did with the kids. But, you know, that's a joke. Don't
still
tell him
struggling now, Kevin. Still struggling now. No, he's all right. He's all right.
No, he's a good guy. I must come up and see you guys as well.
Yeah, definitely. More than welcome.
Have a cup of tea with you. Yeah. Look, Louise, I think we've stretched this as far as we can get, and I think you've opened up brilliantly. You've talked about it. You've been very open about what you've gone through, and but more power to you. Keep going. Keep doing what you do best, and keep that smile going.
Yeah, I will do. And I think that's what it is. I think anyone who's got rheumatoid arthritis, it's you just have to try and keep positive, and it's about controlling the pain. That's the biggest thing. Don't sit there in pain. Knock on your doctor's door and get the right medication. Because I have spoken to quite a few people that get diagnosed, and it's a bit of a shock when you're first diagnosed. But I think, and it goes up and down. I mean, I don't even know. I had a knee replacement. I've had lots of operations. Knee replacement, hand operation, foot operation, pins in my toes.
Sorry to interrupt, but you've just reminded me of something, actually. Now, correct me if I'm wrong. You had to go and have, was it one little toe off or two little toes off?
No, I've got all my fingers and toes are still there. I had a complete knee replacement. I was probably, I think I was the youngest, I'm sure, I know the second youngest person in Surrey, according to my wonderful knee surgeon, to have a full knee replacement.
I thought there was an operation you had some years ago that you went to see the specialist and you said to him, if I don't have this operation, that means I can't put my high heels on.
Yeah, that was my foot. Apparently, he still talks about me. My friend Cressida went to see Mr. Solon, and apparently he remembers me for being really positive and enthusiastic. But no, he basically, my toes I had to have pins in my toes to straighten them.
Oh,
and
yes.
Yeah, so, and then he pulled them out. I don't think I've ever had any, well, the knee replacement was quite painful, but the pins out of the toes, that was something else.
Yes,
and he didn't give me any painkillers, he just whipped them out, and they were really long.
Oh, right. But is that right? You said if you didn't have the operation, you wouldn't be able to put your high heels on.
Yeah, I did say that to him. And unfortunately, I can't put, I mean, sometimes I might force myself to put, not high heels, just a boot with a bit of a heel, because I can't. When I was younger, my friends will back me up on this. I was always in heels. I remember going to Spain and even going to the supermarket in a pair of heels. And I think it was just a way of me going, I'm not going to beat, this illness isn't going to beat me. And I'd be the one hobbling out the nightclub at the end of the night in my early 20s. But I've succumbed now. I wear trainers. They'd say, you've got trainers on. I don't care. This is my illness. Like, you don't understand how it is. So I have to wear trainers.
Oh, dear. Listen, Lou, as I said just now, stay positive. Keep doing what you're doing. And more power to you, because I think you're brilliant.
Thank you, Kevin. Thanks for giving me this opportunity as well.
Oh, no, thank you very much for agreeing to do it. It's been brilliant. Thanks very much indeed. Okay, Lou, I'll speak to you soon.
Okay, see you later.
Yeah, bye-bye. Take care. Bye.
You too.
Bye. Bye.
Bye.
Hi, my name's Louise. Thanks so much for listening. If you enjoyed this video and you want to hear more from Kevin, please do subscribe to his channel, Kevin Rambles, and then click on the bell below to be notified when a new video is uploaded. Thanks a lot. Have a good day. Bye.